Hello and welcome to the fourth installment of the Colorado State University Prevention Extension Cast. I'm Nate Riggs, Professor of Human Development and Family Studies, and the Director of the CSU Prevention Research Center, where our mission is to promote healthy development for individuals and families through research, training, and engagement. I am thrilled to be joined today with Drs. Raven Weaver and Cory Bolkan from the Department of Human Development at Washington State University. They're going to be discussing the importance of engaging with our aging communities, and particularly during the ongoing COVID-19 pandemic. Dr. Weaver is an assistant professor on the WSU Pullman campus. Her specialization is in older adults' utilization of long-term community services and supports, meeting the unmet needs of older adults, and the influence of geographic location, i.e. rurality, on older adults' physical, emotional, and psychological health and well-being. Dr. Bolkan is an associate professor on the WSU Vancouver campus, and she specializes in healthy aging, aging in place, grief, coping and loss, as well as elder abuse. So thank you both for joining us today. And for those of you in the audience, welcome. Today, Drs. Bolkan, Weaver, and I will have about a 45-minute conversation on the topic of engaging older adults during the global pandemic. And then we'd like to spend the last 15 minutes or so answering any questions that you may have for our guests. So you can place any of these questions in our chat bar to your right, and I'll do my best to get to each one. So I'll be monitoring that Q&A throughout our discussion. So for those of you who have joined previous Prevention Extension Casts, you might notice that we are on a new platform, Microsoft Teams Live. There are a lot of advantages to this platform over the one that we were using previously. However, the capacity to have more than one person on the screen for this type of format is not one of them. So you'll only be seeing one of us at a time, and I don't think this is going to be too much of an issue, other than there may be some small lags at times between when someone starts talking and when you see them on the screen, and it might be particularly during the Q&A period. So I just wanted to give you a heads up on that. All right, so Drs. Weaver and Bolkan, let's get to it. So the first question that I have for Dr. Weaver: can you set the stage for us about why we collectively as a society should care about an aging society, and why should the general public care or have an invested interest?
Yeah, absolutely. Well, thanks for having us here. So first off, we really want to talk about the demographics of aging, and not just in the United States, but globally. So to set the stage really of why this matters for us. So for the first time in history, we are approaching a time when the world will have more people that are age 65 or older than there are persons 5 years or younger. So this also can be summed up as more than 2/3 of all human beings who have ever lived beyond the age of 65 are alive today, right now. And so this is a change that it's unprecedented. We've never experienced it before, which brings us a lot of opportunities. So in the United States, as of January 1st, 2011, on that day and every day for the next 19 years, so until 2030, 10,000 boomers are reaching the age of 65. As of 2019, the population, the American population of adults age 65 and older was 16.5. And to bring it even closer to home in Colorado, that percentage came in slightly lower at 13.8% of the population being 65 or older. Most Coloradans want to remain, they're long-term residents, and they want to remain in their homes and communities. And that's no different than the general population in the US. So people want to age in their homes, their communities. And the big question that emerges really is, well, how can we create age-friendly communities? And then again, especially in rural areas. So how can we design to better meet the needs of residents? Thinking about transportation to outdoor spaces, thinking about community supports and health services and access to those services, civic participation, engagement, employment opportunities, social participation and inclusion. The list really goes on. So we all hope to grow old. We all know older people. We love our grandparents, our parents, but there is a pervasiveness of ageism, and that's really where a challenge is, that we all have to confront this and disrupt ageism. So the myths about aging can lead to negative stereotypes. Negative stereotypes about older persons then may result in ageism. So ageism is defined as unfair prejudice or discrimination on the grounds of a person's age, any age, not just older persons, but we typically think about it in that term. So who gets the chance to grow old? That's the next question that we try to understand. We cannot rely on averages. We have to look at the broader patterns of inequality that come through, the structures that really determine who gets the chance to grow old, under what circumstances, and how then we can, again, disrupt the inequalities that exist. We have to think about racial and socioeconomic inequalities as well, and thinking about how that leads to those different opportunities and truly shapes outcomes in later life. So as a society, we tend to hold the different generations, young versus old, against each other. We tend to pit them against each other, and that the interests of older adults are at conflict with those of younger people. But we have to shift towards a more interdependent framework, and that can show us how generations complement each other, and we can learn from older people and younger people if we are older, and work towards a greater good. Because after all, we really all want that chance to grow old. So that's why we all need to have an invested interest.
Great, thank you. All right, so the next question that I have is, what role can extension faculty, public health and prevention professionals play in supporting adults in later life? That one's for you, Cory.
Great, thank you. I think there's a large role that all of these professionals can play in addressing some of these, this big picture that Raven just painted for us. And I definitely want to kind of reiterate this idea of an aging society is a permanent shift. So I think sometimes we tend to think and focus so much only on the boomers, and we hear about that a lot because they're currently the older population, but this is going to be ongoing. It doesn't end with the boomers. And just for a little, I saw this recently that the oldest of the millennials will start turning 60 in 2040. So that's not going to be too far after all the boomers have already crossed to 65. So it's kind of this trend will continue. Adults have long been neglected in as a target audience for health promotion activities. And to give a little context for that, just a little background, it was probably around the 1990s when it was first introduced as an idea that we should target health promotion for older people. And up to that point, the general consensus was, it's just too late. It's not a good idea. People can't change their lifestyle. So it was a very declinist perspective, and unfortunately that still gets perpetuated today. So the points about ageism and age discrimination are very salient and kind of ubiquitous in our society. And it really wasn't until around 2001 when experts of the World Health Organization kind of unanimously stated and put forth this idea that it's important to be healthy in our lifestyles at every life stage. So we've really only had about 20 years, really, of pushing health promotion activities and measures to older people. And we're seeing a lot of evidence that we're finally growing some of those programs, and we need to continue to do that to meet the need of our aging population. There's a lot of evidence that dispels those previous myths that people can't change. And that older people are rigid or don't want to change. All of that is untrue, it's unfounded. And we know that exercising, quitting smoking, managing moderation of alcohol consumption, being engaged in lifelong learning, being integrated in the community significantly helps in terms of disease prevention and health promotion and keeping people's functional capacity as high as possible. So this improves not only quality of life on an individual level, but it also has a societal impact and a community impact, because we want people to age as healthy as possible, because just within this decade, by 2029, 2/3 of our entire federal budget will be devoted to people 65 and older, mostly through Social Security, Medicare. So healthcare costs, this has real serious implications. And we know that we can see measurable change and health that benefits people even in their 8th and 9th decade of life. So it's never too late. We definitely want to reiterate, it's never too late to think about these types of interventions. So I think all in all, there's been a little bit of I kind of joke, maybe a PR problem with gerontology of how do we recruit people to be interested in the field, to want to serve older adults, to recognize our own, aging and mortality, to face this. There's a lot of emphasis, if we want to think about prevention, that we think early in the lifespan, and we think about children, and children are easy to, we want to work with them, we want to help them. They're great, they're wonderful. I have kids, I love kids, we need those programs, but we also have to think about the full life course. So what happens to these kids as they become adults, as they become midlife? How are we going to set the foundation for a healthy life course? So there definitely is this major, I think, need for public health prevention scientists, extension professionals to really help to translate what we know in the research side about healthy aging and the importance of this on an individual, family, community, society level, to make these changes. Everyone wants to live longer, that's great. No one wants to be old. So how do we maximize those extra years at the end of life? And, in short, I think extension is particularly a great vehicle for translating some of these evidence-based practices and knowledge to the community. This is a critical time for doing that, educating our communities and preparing people for their own individual aging journeys. So certainly awareness of this is a role that these professionals play, advocating for and targeting more efforts to programs that engage older people to maintain their health and well-being. So I know we'll talk more about that, but I better pass the baton here.
Yeah, that was great. Thank you. Dr. Weaver, your initial comments were spot on, and Cory, you too. It's prevention science has had this bias towards early stages of the lifespan, and we're just now starting to focus on the later end of the lifespan and optimizing health and healthy aging. And I think that WSU in your prevention science program, and then CSU in our aging, the faculty that are doing work in aging and the Prevention Research Center, I think there's a lot of opportunity for us to be innovators in this space and show up in spaces like the Society for Prevention Research and say, hey, we need to be doing this work. Let's make this a focus of the society, of academia, of prevention science. So thanks for that. So Dr. Weaver, what are the key issues and challenges that are affecting older adults during the COVID-19 pandemic that we find ourselves still in?
Yes, we are still in it, and you'll see this theme of ageism come up again, and that's really where I want to return to, because we have to think back to the messaging of how the messaging at the start of the pandemic was, and how really that messaging was ageist. It was ageist and so detrimental to our country and globally. So while older adults are one of the most vulnerable groups to the virus, everyone has a stake in this fight. But because of the messaging and how it started, basically that it was just affecting older adults negatively, the risk of death was higher, and it's just like the flu, so it's fine for younger people. It took a while for people to take the virus seriously and to jump on board to being proactive in mitigating the spread. So in reality, the negative stereotypes really were about young and old people, and those stereotypes spread widely during this pandemic, and they continue to spread. And so it's led to this outbreak of age discrimination. And again, we hear how detrimental this is. And there's a lot of research that shows individuals that are more have more positive aging attitudes have longer lives. They recover faster from illness when they are older. But conversely, when they have negative attitudes about aging, their future older selves, they have the reverse. So increased risk of premature mortality. They are more prone to accident and injury, and so forth. There's a body of research there. And so it's really important for us to think about this as our future self, and that's really where we are, why it matters. So I'm tying it back in. But in addition, we also have this larger societal issue around how the pandemic has been handled just in general. And at the start of the pandemic, There was research and evidence showing that special clinical protocol was developed first for children and adults with COVID-19. And like Cory said, that's good, that matters, we need that. But it took a while to look at the 65 and older population. So again, overlooking one of the most vulnerable populations there. Then the decisions about who was going to get a ventilator came up. And again, the societal concern of healthcare rationing. We have to think about that. We just as early as the beginning of January, we were hearing about hospitals and ERs in Southern California telling paramedics, don't bring people here, or only bring them if they have a chance of recovery, of survival. These are really political, contentious, difficult questions, and we're not saying we have the answer to them, but we have to think about how as a society, we're gonna decide who gets, vaccines, who gets the ventilator, and what those decisions then say about our society. So these are just some of the examples of ageism during COVID. And this is what we as gerontologists and researchers are taking away. It's a reflection that we as a society don't value old lives. We're this youth-oriented society. So that's prevalent during COVID as examples of ageism. Another key issue, though, facing our society as a result of COVID is the largest single-year decline in life expectancy in the last 40 years. This is recent news that came out just a few weeks ago, but on average, life expectancy was shortened by more than a year. So on average, we're now living 1 year less, but we can't only stick with the average. And so when we expand this to look at different groups, this hasn't been evenly distributed. So among white Americans, the decline was less than a year. It was 0.6, I think. Black Americans, it's more than 2 years off of their life expectancy. And Latinx Americans, more than 3 years. So again, we're seeing who gets that chance to grow old, even in times of a pandemic. So this is further evidence of the disease's disparate impacts on minority populations, which will contribute to the widening gap that already existed with life expectancy. We're seeing this grim milestone recently that we passed of over 400,000 deaths in the US. And while older adults have been hit hardest, we know the disproportionate impact on racial and ethnic minorities. So you can look at that double and triple jeopardy that's being experienced. But with each loss, the toll that it takes on survivors is enormous. A recent study calculated that 9 family members are affected by every person who dies of the COVID-19 virus. So with over 400,000 Americans that have died, that means nearly 3.6 million people are grieving. So we have, in and of itself, the long-term impact of a grief pandemic that will long exceed the COVID-19 pandemic that we are, as you said, still in the thick of that. So we have to think about how we age in context of others. We age within our families, our communities, and our societies, and how we have to join together to see our common humanity in that. The most vulnerable to the pandemic are older adults that are in long-term care settings, but we want to focus our conversation mostly on community dwelling older adults and opportunities for health promotion, disease prevention. And so the key issues there relating to older adults are related to isolation and the need for social connection. We've heard these a lot in the news. We may feel them ourselves, whatever age we are. And so these are challenges, though, that existed prior to the pandemic. They've just now been exacerbated and the spotlight has been shown on them. So isolation and loneliness among older adults was already considered an epidemic of its own. The risk of premature mortality attributed to social isolation and disconnection is comparable to other health risks like obesity and smoking. Social and physical distancing is contrary to how we're supposed to operate as humans. And without having connection, without being able to spend time with our loved ones, we're all experiencing this challenge. Many older adults miss the opportunities to spend time with their grandchildren. And for some adults, they've lost that form of childcare that perhaps the grandparents provided. We can go on and on about the ways that we've been impacted. But we also then should think about the ways that we can learn from what older adults' experiences tell us. We can capitalize on older adults' resilience, and we can ask ourselves, what can they teach us from how they are managing this really challenging time? So what can we learn? Well, older adults are resilient in regards to their psychosocial well-being, which may be surprising to some, but we have to also think about how older adults have more lived experience. With every year, they can see a bigger picture. They can see that this too shall pass. And they're able to then manage the challenges at times better than younger generations in regard to how to manage their social isolation. There is also this concept of transformative resilience, which is being able to see the challenges and reframe the situation to see the opportunities for growth. And what does this challenge mean moving forward, and how can we persist through it so that we can see the other side? So older adults have consistently demonstrated in many ways resilience, grit, and the lessons learned, and they continue to show the concept of generativity, of giving back to others. One example that's been in the news recently is how some retired nurses and doctors are deciding to come back into the healthcare field to help administer vaccines, which we need that. And so others have been offering care for children who aren't in school. And so perhaps they were a grandparent raising a grandchild, and now they're their teacher as well, and many other figures in their life. Or they're helping their isolated neighbors be able to connect better. So in sum, there's a lot of these challenges that have existed before. They've been exacerbated, but we also have to turn to how we can learn from the resilience of older adults and capitalize on what they're teaching us, the younger generations.
Great, thank you. Yeah, I was just reflecting there on your comment that the effects of this pandemic are multiple and beyond the direct effect on aging individuals and the people that are affected by they're infected by COVID-19. And so, and we all have a part to play in this. So, Dr. Bolkan, how can university researchers and extension professionals engage with older adults to promote healthy aging, both now during the pandemic, but then Dr. Weaver also talked about the grief pandemic that we will be experiencing after the pandemic is over?
Yeah, oops, gotta wait till I'm is on. There we go. Hello. So just kind of shout it out. Yeah. These are really great questions, and I love how Raven kind of framed this as there's certainly, a lot of need for older adults, but we also have to recognize the value and the meaning that older adults bring to our society. And that again goes back to disrupting these negative narratives about older adults. So they're always a drain, that we kind of have this. We hear a lot about the silver tsunami or this age wave, and it always just feels like this catastrophic, event of an aging population. But we can flip that script and say, well, what are the advantages of that? And how can we maybe utilize those resources of older adults, their years of experience in the workforce, their life experience? And I imagine maybe some of that life experience with dealing with hard times and grief is something that will come into effect in the coming years, for sure. So how university researchers and extension professionals can do this, I think overall, pre, during, post-pandemic, the first step is just a really simple one of being aware of this huge shift in our population, shift in our world. I think some of us kind of recognize, we might see these statistics and go, oh yeah, like that makes sense, I get that in my head, but really knowing deeply and understanding the repercussions for how we have to kind of redesign our societies is a major undertaking. It's really going to take an all hands on deck approach. There's going to really need to be some major kind of public health efforts, not just to focus on this idea of longevity and life expectancy and lifespan, but kind of promoting a health span. How can we keep people as healthy as possible for as long as possible? So kind of becoming aware of that, advocating for and implementing initiatives that include and support older adults. So developing plans for this, especially I think through extension, are really useful. I think just as a kind of side note, being able to seek some training too, and maybe furthering our own education and understanding of how to engage with older people. We already know that the lack of trained geriatric gerontological professionals is, some describe, a crisis of epic proportions, because we just don't have enough people to meet the demand of our new population demographic. And so I also argue it is important to have a good understanding of the unique developmental transitions and opportunities for growth that happen in adulthood, that it isn't just this straight decline into, into old age. So again, that awareness, education, training, certainly important. Understanding your audience, what are the unique ways to serve and be with older people who might have vision or hearing changes or mobility issues, transportation needs. So some of that I think is just being aware of it. But in terms of advocating and implementing programs, how do we actually move something forward? It doesn't have to be reinventing the wheel. There's a lot of initiatives and organizations that are doing some of this work. So I think the first thing that researchers and extension professionals can do is maybe identify and reach out to those in your community that share the similar mission of engaging older people, especially in healthy aging. So places to consider, and I'll just kind of shout out some, but maybe if you want, we can send some notes or a list of some of these organizations if that's helpful. But thinking about area agencies on aging, every community has that. They receive funding from the Older Americans Act. It's a really great resource. They do a lot of outreach with and program support for older adults, senior centers, care communities, departments of aging, health, social services, AARP chapters. There's also a lot of organizations and agencies that are involved with services and aging issues, and that's the National Council on Aging, again, maybe AARP. There's also Engaged, which is the National Resource Center for Aging, Center for Engaging Older Adults. Little more academic, but certainly the American Society for Aging and the Gerontological Society of America are great resources. But in terms of even breaking it down more for specifics, how you're going to reach an older population and how you're going to, target them, market to them. Again, having these partnerships, working with Meals on Wheels, other kind of home health organizations, working with them will help you to identify and reach your audience and leverage your resources. So are there ways, I know funding is always a problem, so are there ways for communities to work together and leverage funds maybe through the Older Americans Act with the AAAs, not the automobile one, but the Area Agency on Aging folks. And I think it's really important to know your community and engage older people in that process. So if you want to start to become more active in that area, or designing and or not even designing, but just implementing already established evidence-based programs, to engage those older people, invite them early in that program planning process. What do people want? There are a number of different programs and targeted interventions, but what does your population need? Do you need more that focus on the oldest old, people who might need more caregiver support, employers of caregivers? There are some extension programs already designed for that, or even professionals who work with older adults, or is it for a younger, older population? And there are kind of Also, I think 3 really good examples of stuff that's already happening that we can just kind of tap into. So I know that through NIFA, the National Institute for Food and Agriculture, has an adult development and aging work group, to which I believe Dr. Christine Fruhoff, one of your own, is a member of this committee. So I'm sure she also has a lot of great expertise and tips to share in this. But part of their goal was to really survey all of the national extension programs and identify what's being offered across the country. And so there is already a list kind of developed of 75 different programs targeted, for an aging population, that lists what the program is, some of the evidence base for it, where it's being offered. And so that's a great resource. So networking and using this to disseminate that information is wonderful. I've also seen a lot of great work happening through the North Central Region Aging Network. Yes, okay, got the acronym correct, NCRAN. Easily Googleable, but it's a great example of a recent collaborative of extension professionals and gerontologists that came together across 10 states to really be dedicated to improving the health and well-being of older adults using science-based strategies. So I just feel like they have a great kind of repository of resources, or a good model to think about, can we build other collaboratives in other parts of the country, go beyond just this North Central region. And then also another, I think, kind of creative idea that I've seen come out of Michigan State is a model of health extension. So through the Affordable Care Act, one of the mandates was to create a national primary care extension program, but no funding was allocated to it. So it's kind of hard to run that without the funding, but it was modeled on the cooperative extension model. So is there a way to utilize already established extension network to partner with medical schools and to work with community members to help to promote health in that avenue? So I know we at WSU have a fairly recent medical school that's community-based medicine. And so I feel like this may be a good opportunity for similar programs. I believe that you all maybe have a partnership med school at CSU with Colorado University. So I don't know, maybe there's some really interesting avenues to think there. I think the main point is just to be creative, think innovatively, leverage partnerships, work together. That's the only way we're really going to achieve some big gains here. So hopefully there's a few big picture and maybe some smaller picture how-tos. I don't know if Raven, you want to add more, you can. Otherwise, good.
All right. Yeah, thanks for that. Yeah. Sounds like there are a lot of resources, a lot of ways that universities can partner with communities to engage with older adults. So I guess maybe getting a little bit narrowing down a little bit, are there any, or I'm assuming there are. So what are kind of the best practices or success stories for engaging older adults in healthy aging research and practice? And that one's to Dr. Weaver. Sorry about that.
Yeah, no worries. So first off, I think we need to acknowledge that there is less known about implementation and best practices for programs of older adults. So while there are programs, we need to, again, prioritize really understanding the assessing, evaluating, and seeing the long-term benefits of these programs. But there are certainly still best practices, success stories that I want to highlight. And also, just to build on what Cory shared, these programs really help us achieve that land grant mission of supporting individuals in our communities in the state, and that have implications or are applicable to everyone or broadly. And so we have to rise up, we have to meet those needs of older adults to carry on the full lifespan prevention approach. So during the pandemic, some of the best practices that have been identified really start with what existed and how they could modify then to meet the needs for a virtual world that we all are living in, for good or bad. And we have seen things like, in addition to the program modifications, things like concerts, live Zoom concerts that are intergenerational, that anybody can join in, and the music lovers are able to see younger people play their skills and share their love of music as well. Other smaller things that are pretty easy to implement are snail mail campaigns. I love snail mail personally, and I think it should be the best way to communicate, but pen pal campaigns, so being able to connect. This is something, for example, if there's a youth program that you're involved with, you could connect with them to then partner with perhaps a long-term care facility or a senior center that no longer can meet, but being able to establish that connection, because the social connection is what that would prioritize. We also have ways you could organize things like a comedy show for people that maybe aren't so much into music but love comedy and they're missing out on that opportunity. We have music therapy online opportunities. There's ease and convenience for that. And so again, none of this really is reinventing the wheel. It's building on the past and seeing how it can fit in a virtual world. There's also things for technology support. And so that's typically perhaps a stereotype that older adults cannot use technology, but there may be some challenges as we're all navigating these newer platforms. And so having opportunities for example, intergenerational mentor matches that then they would be able to help get them connected and be able to then connect with their families that are living, or maybe not even living, far away now, but they cannot see in person. One example, though, of how an established program, the Aging Mastery Program, has been modified. And so the Aging Mastery Program is through the National Council on Aging, and it's a program that encourages behavior change across several dimensions of aging, including gratitude and mindfulness, finances, future planning opportunities, community connections, and legacy and purpose. And so this program has been tailored to an online delivery, but also then to focus in on maybe an even more vulnerable group, rural communities. And so it used to be face-to-face, but rising up to the occasion, they were able to transition to online and still run and offer this type of program. Washington State has recently joined in this effort, and so we are getting ready to implement some AMP, Aging Mastery Program, around the state. Other opportunities that I want to highlight are intergenerational opportunities, and they're a great avenue to consider, especially as we think about the more established programs that are youth-oriented. For example, I know through CIFAR, the granting organization, Dr. Shannon Jarrett at Ohio State leads Food for Long Life. And that is a program that is community-based intergenerational project that promotes healthy food knowledge, consumption, and access among preschoolers and their families in food desert areas. So in Ohio and Virginia. So these intergenerational families learning how to understand the food realities and why it matters for healthy development from preschoolers through family, all the way, all generations. And they've been able to modify their approach as well to ensure that they can still meet the needs of their population, even during the pandemic. There's opportunities to match young and old participants. For example, kids from a robotics club are supporting older adults' technology use. I know that that is happening in the Seattle area in Washington State. So as Cory mentioned, there's so many ways to find out about this type of information, programs, collaboratives. I also encourage you to check out the Reframing Aging Initiative that you can Google that and you'll find information there too. But basically, so much work has been done and we don't still have all the answers. We know some of these facts. We know that it's an important area to focus in on to promote health and well-being. We know these demographic trends. We can't predict the changes, but we can certainly meet them with opportunity and open arms to see how can we be creative. There's a lot of room to reimagine and innovate. And how can we then effectively do this to bridge the gap of the generations rather than further divide us into young and old?
Thank you, Dr. Weaver. Yeah, I mean, that comment really parallels some of the comments that are being made in the chat that I'm seeing about needing to flip the narrative and raise awareness of the advantages of increasing older adults and inclusion of older adults and intergenerational families and things like that. So that's great. Thank you so much for that. So you talked about a lot of the, I guess, innovations that are happening in this space. And so my next question is to Dr. Bolkan. How do you think the pandemic is going to change the landscape of aging programs and services? I'm imagining that there's going to need to be a lot of innovation that's been happening and that is going to need to happen moving forward.
Yes, I agree. I think innovation is going to be and reimagining is going to be a big theme as we move forward, and that's going to be across probably many different sectors and many disciplines, I'm sure, as we face some of these, the economic and social costs of the pandemic. Early on in the pandemic, I read this essay by Arundhati Roy, and I just was stuck with me this whole time. And it's one of the themes is the pandemic as a portal. That might be the title of it, but just the idea that every pandemic that's ever happened changes our society. This is not going to be any different than other ones. And so as we move through this, we have an opportunity to really imagine a new world. We don't need to take with us the things that weren't working before. So kind of trying to shift that and think, how do we reimagine and invest in changes that weren't working? And I think the pandemic really exacerbates some of these issues, some of the intergenerational tensions. We really need to think more about how do we bridge this? How do we learn to live in a multi-generational society? We have up to 5 generations working together in the workforce. So these are going to be permanent shifts again. So we have to figure out how we're going to adapt. So I think the pandemic is putting a spotlight on some of those issues. And we need to think, what's going to look different in the future? I think work and family is going to look very different. People probably work longer. There's more evidence that's showing that's better for our health anyway. We have to think about families and caregiving as we live longer. So in terms of the landscape for aging and programs and services, one, I'm sure we all value and are so much more aware now of the importance of connection with people, how difficult social isolation is. So I think we're going to have to lean on each other a bit more. Again, bridging those generation gaps. We have a stronger together kind of mentality. I think we're going to need to, we're going to see some changes in terms of technology and how we're going to maybe continue to adapt. Some things that we've shifted to online, older people are actually preferring it that way. It's easier for them. They don't have transportation issues. So we might think about innovative interventions in terms of technology, maybe developing smart homes, smart cars, all of these things, or driverless cars, right? I think also a big focus on social justice. So Raven has brought that up a couple of times, but just the opportunity to grow old is not equal. So really thinking about these inequities across the lifespan and how are we going to do a better job of really addressing those. So if anything, the pandemic certainly amplified some of these issues and these challenges, and really the world is open in terms of thinking about innovations of what we're going to do. So if you have a really great vision for this and a way to bring people together, there's so many opportunities in the field of aging and gerontology and working with older people. So again, all hands on deck. I know we're running short on time, so I'm trying to keep it brief.
That's great. No, thank you. Yeah, a lot of space for innovation. And I think that there can be opportunities for communities to partner with researchers and extension professionals to develop and test innovations in this space. And I know that that's one of the great things about both CSU and WSU being land grant institutions. We pride ourselves, we value engaging with community members on community engaged research. And so there was one question in the chat around where communities can partner with researchers. In what spaces can they partner with us? And there are opportunities. We have several faculty in our department, and I know that you all have several faculty in your department who do research in healthy aging and have a desire to work with community partners. And I think that one of the things that community members can do, I know this isn't the most interesting thing to do, but is to go to the HDFS, CSU HDFS and the WSU Human Development websites, and maybe Miranda can drop the links of those in the chat if she has the capacity to do that right now, and identify faculty researchers who are doing work in those spaces, and reach out and see if they're interested in partnering. I know also at the Prevention Research Center, we provide community services. We will partner with communities on developing, thinking about implementation, also thinking about evaluation of community-based programs so that community members and community organizations can be relatively, sure that the services that they're providing are based on best practices and are successful, are effective at doing what they are intended to do. And so, if anybody is interested in partnering with the Prevention Research Center on this, feel free. I dropped my my email and the Prevention Center's email in the chat. And then if any of you, I'm sure that Drs. Weaver and Bolkan would be willing to drop their emails in the chat as well, if anybody wanted to follow up with them. I know that in the past we've had attendees for the Prevention Extension Cast from Washington State. So, if you would like to reach out to them, I'm sure that they would be willing to follow up with you. So this is we kind of come to the question and answer period of the discussion here. And an earlier question, I think it was Dr. Weaver that was talking about the multi-generation families and grandparents raising grandchildren. And one of the questions in the chat was, what portion of multi-generation households depend on the income from seniors in the house to make ends meet, and shared that in their situation that income is essential to making ends meet.
Yep. So I will jump in. So the question is, what specifically is the proportion of grandparents who might be relying on that? I don't know off the top of my head. We could probably find that for you. But it certainly is a really big and important topic. I think this is a great one because it does address these intergenerational issues and the importance of families across the lifespan and aging families. We focus a lot, I know in extension it's youth and families, but these families get older, right? and following them along. For grandparents, there's a lot of really unique needs that they have. So definitely relying on what limited income they might have. It's expensive to be raising a child. And then also just some of the legal issues around that too. I know that we've been getting some stimulus checks as well. I don't know, are those going to the main primary, grandparent carers or not to support the children? I'm sure there are a lot of things that are kind of getting lost in the shuffle of this time. So yeah, Raven, what were you going to add in there?
Yeah, I just wanted to build on that of, again, pre-pandemic times, policies need to also change as we can be advocates for understanding our demographics, thinking even of family medical leave. Whenever we are able to do that, there are sometimes caveats that don't allow certain support. And I am forgetting maybe it's that policy, but I know that there's another that says grandparents that are 50 years and older can care for and receive support. But there is a large proportion of grandparents raising grandchildren that are below that age. And so there's that gap that we're seeing. And again, this is in our systems. This is a systemic challenge that we're facing. So aging policies need to meet aging families, which are changing. They're more diverse than they've ever been before.
Yeah, I'll add on that, waiting for my, I would add on that too, just building on it. That is going to be a big shift in the future moving forward. We have to adapt this, the cultural lag in all of our kind of aging policies. They're based on these outdated notions when we didn't live as long as we did. So I think we're going to really see a big shift. And as we change and become more diverse, we'll start to notice these gaps in policies and what's available, and gaps where we're going to need to build new services and supports. And this may be one. Yeah.
Thank you both for that. Yeah. So we have another question from someone who is a WSU teacher but lives in Fort Collins. So
go Cougs.
Even more crossover here. So the question or the statement is that that this person has a 91-year-old mother-in-law who lives in a senior facility that is on lockdown, as so many are, and it is really lonely. Any ideas on how to address the social isolation and loneliness seniors are facing right now?
Okay. Oh, we shifted. Sorry about that. It was confusing.
So I would just add, one of the easiest things to do is just to call or check in every day in some way. And while that's not ideal, and maybe we wouldn't in the past have gone to visit them every day, but I think a check-in really shows that somebody is thinking of you. And one thing, you know, you're not alone. So many people are experiencing this. And my grandparents also are in a retirement community, and we try to organize Zoom calls with the grandchildren or some great grandchildren. And so I think if there's a way to make sure there is some type of connection each day, that helps. It's not ideal, but just that small gesture means a lot in that terms.
And I will build on that a little bit more. I think there's certainly, that's the practical side that we can do, and we have control over reaching out to our loved ones. But I think it might also be worth talking to, you know, the administrators of these care communities to talk about what are their policies to really address this issue. I think we've now been in this for enough amount of time that we recognize we can't just keep people locked up and away and isolated with no visitors. So we have to, again, be creative and adapt those policies. And what I've seen from long-term care is there isn't really a consistent universal approach to how different communities are addressing this. Some are just locking down and not allowing any visitors. Some are getting really creative and finding ways to find an outdoor space where people can be, you know, physically distanced, mask wearing, and still see people in person. So I think, you know, this is one of those things where we're going to see a lot of changes in long-term care, especially since it was hit so hard with the pandemic. What do we need to change and revise and reinvent in that arena to be more supportive to older adults, you know, social and mental health needs?
Wonderful, thank you. So it looks like that might be it for the questions in the chat. I'll ask both Drs. Bolkan and Weaver, do you have any kind of final parting thoughts before we sign off today?
Well, I just am very, very thankful that you all, you know, are interested and have taken the time to attend and be here. I think it shows that you all are already taking steps, you know, at CSU to think really full life course, and you have been engaged in some ways of targeting and reaching older adults. So that's really commendable and wonderful. And just, I think a takeaway for me is to just recognize that everything we've thought or we've planned about the world is going to look different, and the world is changing, and we really need to adapt to that because there's going to be lots and lots of older people, and we're going to be one of those. You know, we will become older someday, hopefully. What a great, you know, opportunity. And so for us to maybe think about about the work that we do in working with older people is also a benefit for ourselves. What kind of world do you want to live in? What do you want the world to look like for you as an older person? And that's kind of one of the driving factors too for why I'm so passionate about this work. Really recognizing the value that older people can bring as a resource to your programs through volunteering or helping to support the programming you have, or be creative about ways you can meet people across the lifespan and integrate intergenerational opportunities. So those are a few parting thoughts. Raven?
Yeah, I would just echo what Cory said in so many ways. And I wanted to just highlight again, it takes a village. It's all of us. And so being mindful, being creative, thinking outside the box, that's really what will get us to live in a world that we want to live in, like Cory shared. And so how can we take that active step? And again, I want to commend y'all for pushing the lifespan prevention science approach. And we're excited to do the same in our work and the outreach that we do in the partnership. So thank you so much. This has been great.
Well, I'd just like to thank both of you so much for such an engaging conversation. It was really great to be able to talk with you about all of your really important work, and I'm sure our audience is very thankful for that. So that's it for today. Again, I want to thank you both, and for everybody out in the audience, thanks for joining us. And you can find a recording of this and the other prevention extension casts at the link that I provided in the chat. So everybody have a wonderful rest of your week and hope to connect with you in the future.